MPS situation and keep everybody in the loop. Just wanted to draw our attention to the homepage for the health department. Has a link to all the information that's been shared, and as new information comes out, we will continue to update the website. At the bottom, there is an opportunity to submit a request for a call back. So if you have further questions as a parent and you're looking for more information, you can scroll all the way down to the bottom and make that request. New for today, we have the Maryland Avenue Montessori lead risk assessment and orders. The risk assessment for that school was much better than the other schools, so we're really pleased to see that school in great shape. Some remediation is required for that school, but that LRA is really good. The water results are still pending, so we'll be providing those later. But I think the most interest today is to talk about Trowbridge School. This is a school that we, again, had, with all the other 4 schools, had a lead poisoning case referred back to the department, and that is why we went to Trowbridge to investigate potential lead exposure there. Throughout our communication with MPS and working with them, we did see that there were lead hazards at that school. And on the 22nd, which is this Saturday, we did our lead risk assessment, going into the school and doing the lead sampling, looking really comprehensively from top to bottom about any potential lead hazards. We had done a visual inspection of that a little bit before that lead risk assessment, and certainly have been communicating with MPS on what is going on at that school. Obviously, the choice to do a closure for the school is a departure from where we've been so far during this process. And throughout the whole process, MPS has been really collaborative, and we've been working really closely with them to ensure that we were doing everything we could to continue to protect the health and safety of the students and staff in each of the schools. With Trowbridge, the process that was used was what we think not the same as the other schools. So Golda Meir, as we all remember, was an ongoing process that took a couple weeks. There was work that was happening when the students were in the building, and obviously the lead detections came back much lower, and really pleased with the work that was happening there. With Trowbridge, some of the updates were happening and the remediation was happening, but 2 things happened that kind of made it stand out compared to the rest of the investigations we've done so far. So earlier in February, when we were walking through the schools, our staff did observe some unsafe lead work happening. So a staff member was scraping paint without proper containment in the school. That was immediately addressed, and the staff person stopped, and they made the proper corrections to stop doing that. And then the second part was when we actually started getting preliminary results back earlier this week from the lead risk assessment that happened on the 22nd. In those preliminary results, we were able to see that on surfaces that had been made safe or repainted and sealed, there was actually lead hazard dust on top of those made safe spaces. So what to us tells us that whatever process that had been used successfully in the other schools had not been used in Trowbridge, and there is the potential that the levels of lead dust within the school were significantly above what we had initially anticipated in the school. So in collaboration with MPS, we collectively made the decision to close the school on Monday, and MPS stood up really quickly alternatives for the students and the teachers to ensure that there was a very minimal disruption to the staff and classes. So MPS will speak more to what their plan was, but this decision to close the school was a collaborative decision, and really grateful to MPS for helping us work through this, because obviously this is a really major shift for the district, and extremely difficult for the parents as they're navigating having to go to a different school now. But again, because we noticed these additional hazards at the schools in conjunction with the unsafe lead work, we felt this was the best decision, and it was our recommendation to MPS to do this voluntary closure, which is what is happening on Monday. So with that, I'll turn it over to Michael Harris with MPS, and then after Michael's done, we'll take some questions.
All right, thank you. Good afternoon, Michael Harris, Interim Chief School Administration Officer for Milwaukee Public Schools, last name Harris, H-A-R-R-I-S. So here we are. Milwaukee Public Schools stands committed to collaborating with and following the directives and recommendations from the Milwaukee Health Department. We recognize that our practices, we have to make sure that we're continuing to improve those practices as we go in to remediate areas in our schools. We're committed to doing that. I would like to just say thank you to all of our parents, staff members, and school leaders that have stepped up, making sure that this transition beginning Monday will be as non-disruptive as possible. We know that when little ones are in our schools, we need consistency, and that's going to be really important. So we have communicated with our families to ensure that they know if additional resources are needed, that they can reach out to the school district, and we stand ready to assist in any way possible. As far as our plans to continue to work at Trowbridge, our team will be in there tonight, throughout the weekend, focusing on the entire building. We know, again, we're going to revisit our previous practices, improve upon those so that we are prepared. As Mike has mentioned, MHD will be coming back into that space early next week. We want to make sure that we're prepared to do so so that we can see some really good results to get our students, staff, and families back into their home school. Okay.
For both of you, honestly, Michael, and as far as you know, has the district ever shut down a school for lead like this before?
Not to my knowledge.
And then, Commissioner, has the health department ever recommended that the district shut down a school for lead?
Not to our knowledge. I think we have done other daycares, potentially. Looking at Tyler.
Looked at daycares, but I don't think we've ever shut one down.
Yep.
With the levels of lead found at Trowbridge, are they higher than those found at Golden Meyer or at Cogley schools?
They are not. There was a very high level detected in the principal's office on a sill in a bathroom. But the main kind of two pieces that we calculated into this conversation with MPS about the voluntary closure were, again, that we found lead hazards on top of remediated surfaces and the unsafe lead work that we observed. Those pieces, again, were different from the previous work. So again, we flagged those and made this plan to do the voluntary closure. And I think the other side of this too that's really important to stress is that as the work had been happening without the students present in the schools and the other district or other schools, having the closure allows the district to get in there and do the intensive work and not have to worry about disrupting the classes and having to kind of shut down at night or shut down at the end of the day to allow the school to resume the next day.
How long do you think this closure is going to last at Trowbridge?
So as Michael mentioned, we're going to go in on Monday to assess where things are and kind of make a judgment call at that point. Our team has already been in communication with the MPS facilities team to help start that work this evening, as Michael mentioned.
You mentioned that remediated surfaces were showing lead dust.
Mm-hmm.
How does that happen?
So fugitive dust within lead remediation work can, if you clean one surface, let's start with that. If you clean a surface, you make it safe. If there's additional lead hazards in the other parts of the school, that can be tracked back into that space. If there isn't containment that's set up around, some of the remediation work, that can cause the dust to migrate. It could be as simple as someone leaving a fan on and then dust from unsafe areas then blown into a safe area. So there's, as Michael mentioned, the whole school is going to be looked at in conjunction with our lead risk assessment report to ensure that the school in its whole is reviewed and made safe.
So it was improper lead abatement happening?
Well, as I mentioned, we observed that individual doing the unsafe lead work, and then again, our data shows that there was lead dust on the remediated work. So that could be indicative of potential not proper containment, but again, when we recognized what happened and brought this to MPS's attention, we moved quickly to make this plan and make sure that we were going to have a good plan forward to address these issues.
I wonder if you could speak to So back in Golda Meir, the original letter that went out did reference the wall where the child had been lead poisoned as indicating inadequate cleaning protocols and persistent lead dust hazards. So that's, weeks ago, and now we have another case where someone is apparently using improper containment. Why does this keep happening?
Thank you. So again, a lot of moving pieces in the district as far as bringing on new staff members to really help us with this work. So again, we are working with individuals that are being trained. We are making sure that they're following the proper protocols, and once they are identified, we are looking to retrain. We want to make sure that we are doing the right work, so we're maximizing the time that we have these individuals in our schools to ensure student and staff safety. We have and we will continue to improve on these processes as we continue to work with MHD. We are committed to doing that, and so we are hopeful that moving forward, this weekend we will get in there, folks. Everyone will be meeting the expectations and following the protocols that are required.
What's the number of students and staff that are going to be relocated to another school?
There's about 11 classrooms, so 245 students that will be transitioned, and then I would guesstimate anywhere from 25 to 40 staff members.
Will those staff members go to this other school and be in person?
Absolutely, yes.
Why not online? I mean, doesn't MPS have COVID procedures still in place?
Yes, but we also value the fact that we have facilities that we can transition students into classroom to ensure that they have all the resources. And again, we really wanted to make sure that we're not putting our families at a disadvantage. When you're talking about K4, K5, schools are a really important part of that routine. And so to keep consistency with that, we have the space, we have the resources to accommodate families who may have walkers to school that may need a bus now. All of those things were considered, and we're able to step up to the plate to provide those services.
Mr. Todoritis, is the reason that all of these things are happening now and not like 4 months ago because the DHS and the EPA lowered the level for what is considered safe, and now these kids are clocking in above that level when they weren't
No.
before?
So the levels that we're detecting are well above any of the changes in the thresholds. And again, when we're looking at the totality of the school and what we're finding in our findings, because of that observation of unsafe lead work and the clean surface that has the lead hazards on that is again indicative to us that there were some changes that needed to happen to the protocol of how they were abating the work. So it's been mentioned that the numbers have changed, but the values that we're finding were well above any sort of nominal changes that have happened over the last couple of years.
So did the health department just not test schools as part of the process for lead-poisoned children until recently? Is that
correct? So previously, taking a step back, our childhood lead prevention program always follows lead-poisoned children. So that means if someone screens at the lead level that's elevated, we do a comprehensive investigation and then follow those families up to 2 years in some cases. So over the last many, many years, we've always followed children until we see those levels drop. In the recent past, what started this whole thing, we had individual cases that the levels were not going down. And then primary residents were ruled out, and then further conversations and interviews with the family led us to the schools. So.
For Mr. Harris, why was the Wisconsin Conservatory School chosen as a temporary location when it's 5 miles away? Is there not a closer school option? Because I know some people are concerned about the distance, whether they walk or drive.
Sure, absolutely. Thank you for that. As many of you may be aware, the district is engaging in a long-range facilities plan. And many of our Southside schools are pretty much at capacity. And so we really wanted to make sure that staff and students had the space. WCLL is centrally located. Looking at other schools within the area, we felt that that would be the best location for this situation at this time.
The deputy commissioner has mentioned previously that, we wouldn't have these levels of lead had adequate cleaning had been happening. What cleaning processes were there before this?
So We've always cleaned our buildings. Buildings have been cleaned. However, as mentioned before, deferred maintenance becomes an issue within the district. And so we know that we need to revisit, refocus where things need to be addressed, where areas need to be addressed. And we are addressing those issues now. We are devising that plan to review all of our schools to ensure the safety and well-being of our students and staff. This is unfortunate. We are addressing it. We don't take this lightly. This is really a priority for us, and we're going to take care of it because we know our families entrust their children to Milwaukee Public Schools on a day-to-day basis.
Can you clarify what kind of training MPS facilities employees have been given historically and are now given to deal with lead hazards in the schools?
I don't have the specifics of that training. However, all of our building engineers are certified in the areas in which they are hired to perform the duties of a school engineer. And then we have our hazardous staff that is also coming in with certification, so forth and so on. We kind of mentioned that at the committee meeting. But again, staffing becomes an issue with some of those areas, and we have 158 schools. And so, again, we need to refocus some of those efforts to ensure that we have the human capital to go in to assess and make recommendations, and then make sure we're following up with those recommendations to ensure those issues are being addressed.
And so did anything change after Golda and the issues is with the cleaning there? What specific steps has MPS taken to ensure that the people who are now doing this work, like at Trowbridge, are able to do it in a safe way?
Absolutely. So our managers, our supervisors have been working with some external supports to assist us. Again, we have more work to do. We recognize that, and it is a priority for us to address that in our schools. And so the training is ongoing. We learn something different every time there is a test in a school, right? And so we know that we have to adjust those practices and protocols to meet the needs or those areas in these various schools. They range in years of age, and so the conditions. So we recognize that, and it may require more work in one than the other, but we're committed to making sure that that happens.
Can I just add a little bit to that too? So the district has until March 21st to provide a written response to an ongoing maintenance plan, and as Mr. Harris is speaking to, that plan is in constant development, and as we get information back from our lead risk assessments and this ongoing dialogue with MPS, we are refining this process because obviously there is numerous schools that we're talking about that we have not yet gotten into yet. There is a plan in place to start prioritizing those schools and have our staff work to assess those schools. But again, that plan for this ongoing maintenance is going to be provided on the 21st, but we've already begun those conversations with MPS leadership to get this plan together.
So that deadline for March 21st includes an updated maintenance plan while also including the testing of other schools?
So the actual requirements of the plan, I don't know if we're going to include the testing parts of it. So again, what we talked about in previous press conferences, there are certain schools within MPS that are governed under 163 because DHS Administrative Code 163 because they're child care facilities, and then there's schools that are not child care facilities, like Golda Meir Lower Campus is not child care facility. So we're really trying to think critically about those standards to make sure that MPS has the flexibility to maintain their schools, at the same time ensuring that the lead hazards are managed. Ongoing testing and just maintaining of the lead surfaces is a key part of that plan. And I'm confident that we're going to continue to develop that plan and the cleaning protocols to make sure that both surfaces are maintained as well as cleaned.
Is there any update on the testing sites?
Yep. So thank you for asking for that. We don't have the sites exactly. We have a couple locations picked. We're working through the logistics. As we've mentioned in previous conversations, that we really want, in our experience with the COVID pandemic, if you can provide all the services within one space, it minimizes the burden on trying to get follow-up care. So for lead screening, there's the capillary test, which is a finger prick, and then there's a venous blood draw. For children, that is complicated to do, especially if it's a younger kid that can't sit still. For parents that know you have to hold your kid down to do this. So there's logistical things that we are planning for. And then if a child does need a blood draw, there's additional protocols that have to be in place for that. So we're very close to having that done. Our contract to move forward with that with children's is nearly finished. And then we'll announce hopefully next week some additional testing. We're also trying to stand up some capillary screening in our clinics as kind of a bridge to the full screening that we're going to do for the affected schools. And once we have that data back for those screenings, we're going to look at doing some broader testing beyond the 4 schools.
Last question.
Any more lead poisoned students been presented to you guys leading
Nope.
to a different school?
We have not had any additional. We've been watching our data very closely and the testing data that we get for the city, and have not identified any additional children.
Can you just clarify, so, have you verified that a child was lead poisoned at Trowbridge and or Maryland Montessori, or were those just potential sources?
Tyler, did you hear the question?
Yeah, Trowbridge was a case where the level.
Do you want to come up and?
Sure. Let's do a quick review of all the schools on that question. So, Tyler Weber, Deputy Commissioner of Environmental Health. Golda was confirmed lead poisoning due to hazards at Golda. Coggle, maybe a mix of the school and the home. Maryland, we're not sure. We're still working that out. And then, and Maryland was more of us taking precautions after MPS schools were flagged for us. Then Trowbridge was a case of lead poisoning at home. Remediation was done. The lead levels did not decline at a rate that we would have expected, and so that brought us to the school. And so indicating potential ongoing exposure at the school due to not identifying other sources.
And you're still in the potential kind of phase of.
Yeah, and so once lead hazards are controlled at Trowbridge and or the child is protected from those, either via relocation and or, again, the work is done, then we'll monitor the blood lead levels and see where that takes us.
Thank you, everybody.
Is there technical questions?
Yeah, we have
Clarifications,
Tyler available
I
for
can hang
background
out.
stuff that he needs.